So we were going to cover now the schedules. You will need to file your application form and provide us also with the schedule. Each of you needs to complete the Schedule B, which is the complete work estimate. Schedule B is the FEMA application, page 12. This schedule needs to be complete for every contract. To get the funding from the contract costs based on the term of the contract if the applicant meets federal procurement and contracting requirement. So in this box, you will put the total cost of the whole project, and to supplement that information, you will need to provide contracts, change order summary, or any invoice related to that cost. Also, if the procurement policy, which we have a copy, but if you deviate from that procurement policy saying there was only one vendor or two vendors and we're required to have three vendors for the bid, and you deviate from that process, you will need to provide that information for us, like a supplement documentation why you deviate. You can say during COVID-19 emergency, there was not another vendor that can provide that. So I will need that information to get supplemented information for the FEMA application. Also, labor, you will include any staff, and as Brian mentioned before, we can only claim overtime. But in order to claim that overtime, you will need to provide the timesheets during that specific period and the pay stub for the employees that you claim that overtime, okay? So in this area, you will put the total cost of that overtime. And since you claim some cost in these two areas, you will need also to provide this document. This document is on page 33, but it's also in our website in a separate form. So if you need to use this form, you can download that from our website. In here, you will need to put what was the contractor or the vendor and all the information about when that contract was awarded, when it started, the end, it was a bidding process. If not, then you need to comply the center column and the type of contract, the scope of the contract, the total, and the amount. You need to fill out all of this information. This part was the first part that Brian discussed in his presentation, so you will still use the same declaration. You will put your department, college medicine, rec sport, whatever is your department, and then this number that is the default. Then make sure you sign your application or your record, your title, and your signature, not the date, just the signature. When you submit this form, we will need to have proof of payment to this vendor and also the bids or the proposal or the invoice, okay? Then for the force account labor summary, you will need the header. It will be the same always, and we're using category B. The description of the word need to be specific. So we're claiming some hours of these employees as overtime. Be very specific, like Brian mentioned before. They want to tie this to the emergency of COVID. We need to say this employee was working overtime, administered tests for communities, or doing cleaning in this building, very specific in this area because we're claiming these overtime hours, okay? Name, the job title of the employee, the date will be according to our week days, okay? So I guess we start Friday, so that's the date that we're gonna put. You will put the regular hours, but you will not claim those hours. Just the overtime, the hourly rate, the benefit rate, that will be multiplied that, and it will equal the total hourly rate and the total cost. Then add that at the bottom, certify your title and the date. And then for every employee that we're claiming overtime, we will need you to submit timesheets of that employee and the pay stub. Schedule B also is where you're gonna put your cost for your equipment. So if you use an equipment, you own it, you purchase, or you rent it, all of that we can claim it, but make sure We're gonna use the FEMA equipment rates, and you have invoice in the invoice for those equipment and the receipt, so we can claim those. In here you're gonna put the total cost of material and supply. Again, we're gonna file a PPE. So PPE will go in this area. The total cost of the PPE will be the number, the total value will be in here. And then you can say it was from your stock or purchase. But again, if you're doing from your stock, you will need to provide some records and some invoice and receipt as well. And other costs that can be travel costs, utility, expensive will be here. How we're gonna track that is using forms. We're gonna use the for account equipment summary record. Again, the header is the same. And then in here, like Brian mentioned, if you use a pickup to perform the cleaning or whatever to carry stuff, you will need to indicate in this whole information, indicate the size, the capacity, the horsepower, the make, the model, everything in detail. There's a code associated with that. Who was the operator? What days that operator worked? And then the equipment rate. Where you get this equipment rate, you need to go to the table. Let me link that. It's on our website. It's called the FEMA schedule for equipment rates. And you're gonna scroll in this list and we'll try to find and match what equipment do you use to perform the work. And that's the one that you were gonna claim. So for example, in our example, it was the pickup truck. It's down in here in the bottom. So that's why we can claim 1278. That's this total. We add all of this, we sign it, your title and your date. Make sure the operator match. If you're claim those hours, it needs to match the dates and it needs to match with the time card that you're providing. And for every single equipment that you're claiming in here, you need to provide the invoice and the proof of payment for that equipment. If it was rented, then you need to fill out this other form in which you will, again, get all the information about the size, capacity, horsepower, make, model, the dates that that person operated, if you have an operator with that equipment or without the operator, the vendor, the invoice, the date, the total, and if you pay with check and a check number. If not, again, invoice and the proof of payment of that equipment that you rent. Material summary records where you're going to claim your PPE. Again, the header is the same. You can use category B in here. And in here, in this part that said description for work performed, is where we want you to be very specific, and it needs to tie to the COVID-19 emergency work. So it cannot be like Brian mentioned before, because we are at our desk or we're in a conference room just having our normal work, that probably will not be covered. So in this description, make sure you tie that to the emergency. And in here, you're going to put which was the vendor, the description, very specific. You can include also, if you have that information, the size, the quantity, the unit, the total price, the date that you purchased, when do you use it, it was an invoice or stock, then add all that information, sign it, your title, the date, and provide invoice and proof of purchase of that material and proof of payment. Any question at this point?
There's a question Kat Lindsay asked, are you going to double check our work with the smiley face? Yes, as we have to go in and enter all these things into FEMA's grants portal. So we will certainly be making sure it's complete. Working past hurricanes, there's nothing worse than doing rework on these. So we want to make sure it's accurate when we get it submitted. Kimberly Moore said, who's taking the lead for IFAS? We'll have that information at the end. Lee Howell, we just talked to her yesterday, so we'll get more information to you, and she'll have more information on that process. But again, the applications and the documentation you're required to submit is the exact same.
Okay, So we're still in Schedule B. That was the forms. Then at the end of that schedule, they're asking about any disposition. That mean any salvage value or purchase of equipment and supply. I don't think nobody needs to claim this point this. So, and then medical payment, if you receive any medical payments from Medicaid, Medicare, I don't think nobody is in this category. So you don't have to put any deductions in there. So if you have any question, just email us and we're more than welcome to check your specific case. And then at this point, you are gonna subtract all of the deduction. If you have one, I don't think none of you should have one. And that's the Schedule B. It's more just put the cost in the form and the invoice and the timesheet. So make sure you load all of that information. The Schedule D is considered for large project, but at this point, we're asking all of you to complete this. So it starts with a general eligibility. So they were gonna ask you if all of these activities are related to the COVID-19 emergency. It will be a yes for default. And then if you are the legal responsible for performing this activity, it will be a yes in that premise as well. And then they want to know also if this is something, these purchases have been something for immediately threat or life of public health and safety. So you need to provide an explanation in this area. The next question is, did or will any of the activity reported in Section 2 require to access a residential? We believe none of you needs to access any residential or private property. I can be wrong, but again, if you have a question regarding if this applied to you, just email us or call us and we can provide more detail about if it's a yes or no for your specific case. On number 2, it's a part that will need to be complete if you purchase supplies or equipment, and there is where you're gonna put how many you bought and the unit cost. And it's okay if there's not a lot of space in here and you want to provide us with a spreadsheet, you can attach that as well, and you can put just see attachment and we'll take that as well. And then you need to answer those questions, and that will be for a person who are completing these just for supplies and equipment. Part number 3 is someone who purchased land or buildings. Again, this is more about hurricane stuff, so I don't believe nobody needs to complete that part, so you just keep that question. If you purchase some food, water, ice, or other commodities, you will need to complete section number 4. There's a couple of questions about section number 4 about that matters. If you purchase meals for the emergency workers, you can claim that, and you will need to complete part number 5 in the Schedule D. And again, you will need to put that in the form that I discussed previously from the supplies and material. And part number 6 is for movement of supplies, equipment, or other resources. And then here you will need to describe where you move that and the activities that we are pre-position resources. Part number 7 is emergency medical care, and that probably the College of Medicine will need to fill out that information. Part number 7 and part number 8, okay? If we do some sheltering, then part number D need to be complete. And if we establish a temporary facility, then part number 10 of the schedule will need to be complete.
So there's a couple of questions that have come in on what you covered. Patricia asked if we have no emergency PPE, only common use for staff and faculty, no overtime, no equipments. Do we send an email stating that? Do you want a list of non-emergency related expenses? So specifically with PPE, we do want you to, whether it's what FEMA's telling us that they're deeming eligible or not, we still want you to track and submit those expenses. We are going to make a very hard argument that those costs should be covered. Whether or not we're going to be successful, I don't know, but our county had restrictions, the city had restrictions. There's other things we're going to use in our argument to get those costs covered. So I would still recommend for the PPE part that you track those. If you don't have any other labor, equipment, Rental expenses, there's nothing to track or submit. Question, does purchasing food to feed our residents or faculty providing emergency dental care count? No. The eligible costs that FEMA obligates for this category of work is their food costs are covered for EOCs. If they're, let's say, working around the clock, managing the crisis response, they have a very specific line entry that covers that. Our department, Sean Davis asks, our department set up a testing lab to test for COVID antibodies. Would equipment and supplies purchased to set up the antibody testing be covered? I will check into that. Sean, the question there would be, was that for the general public or for our staff, students, faculty? I'm guessing it's general public. I'll research that one for you. Julie says PPE may be purchased for prevention, general use, but we may have positive cases, then it becomes emergency management. Again, we're tracking all the PPE and submitting it. What we're being told they're going to deem eligible is if you're wearing a mask to do emergency work. So we have a doctor, nurse, whoever in the hospital doing emergency protective measures for COVID. That seems pretty clear cut. For me, using a mask on campus because the city or county or my employer requires it, or they've provided it for me, doesn't seem eligible, but we're still going to make that argument. But I understand that definition may change what the PPE is used for. So track those expenses separately. We're going to submit them all and ask that they all be considered eligible. Sorry, Cindy, I just wanted to jump in and address those.
No, that's good.
Okay.
So the last schedule is at Schedule F. It's called the Environmental and Historic Preservation Questions. We believe we're going to apply to complete Part 3 and 4. So for medical waste disposal and the contamination system. So if you did some medical waste disposal under the FEMA guidelines, you will need to complete Part 3. And if you did some decontamination activities, then you will need to fill out Part 4. And they want a description of those activities, and they also want the GPS and the coordinates of where that was the site that we did. And probably Brian can provide a little bit more information about that, the contamination.
Yeah, they're looking at if you've used, Bill mentioned the equipment for air scrubbing or cleaning a facility. It could be you're cleaning, sanitizing, or your PPE to reuse it or something like that. We just want to document what that activity was. FEMA will want to know if things were cleaned, where did that happen and what was the result? If there's wastewater or byproducts or whatever, they're always concerned about where did those end up if they're paying for those expenses. So we'll just describe those activities and where they occurred, and if they have additional questions, we'll follow up when they come in.
Okay. So this will be Part 5. Again, it's more for establish of temporary facilities, and that will be the end of that Schedule F. In summary, make sure you complete the FEMA application form. You sign the Section 4, Part 1 and Part 2. The due date is August 7, 2020. Make sure you attach all the support documentation. You fill out the Schedule B and D. And if needed, a Schedule F. Attach all the forms and all the supplementary documentation. We're asking you to send us an email, which is your department and your contact person, because we're creating a Microsoft Team group called FEMA COVID-19 Grant Access. And that's the way you were going to upload your application and all your supplementary documentation. That group will going to be created, and we're going to send that information to the person that you email us. Will be your contact information. It could be more than one person if you would like. Right. Questions?
Again, from dental about equipment sterilization during COVID. We have to sterilize either way, but can we cover those costs during COVID with these funds? My guess is if you're not doing emergency work for COVID infected patients, you just have to take extra precautions because we're in this new era. It's not going to be eligible. I'm going to check on that though. Kat asks, the testing itself is not covered. Again, that's for employees and staff or students, but is the supplies we use at the test site eligible, or how did you interpret that? We're being told anything related to testing of staff, faculty, students is not eligible. So that would be the labor, the materials, equipment, supplies would all fall under that umbrella. We're going to do our best to get what we can covered. So
we're going to post everything already. The forms and the application is on our website. Here's the address. FEMA also has some YouTube videos that can explain how to fill out the form. So if you need more details, here's the address as well.
I think Lee wants to jump in too.
I think I've been chatting with most of the IFAS people I have noticed in this on Teams. So just note that our process with an IFAS of gathering information will be slightly different. This is all really good information. So thank you, Brian and Cindy. And I will be in touch by Friday with how I'm going to collect it, because I'm going to collect the information within Teams instead of via email. And bear with us, because I see only supplies as an option from what Brian's telling us. So thank you, Brian, for looking into that PPE and hand sanitizer type of questions.
Okay, the questions. Is COVID testing for research allowed? Example, testing for general public as part of an approval IRB protocol. The Emerging Pathogen Institute funds several research protocols.
So we are, in terms of our research on the virus and a vaccine, if it's part of just our research as the university, I don't believe it's eligible. I'm listing these questions and I'll get with our contact at the DEM. They're really focusing in on emergency measures to stop the spread, like we're actively involved with infected patients versus on the research side.
Okay. For training of OPS hourly employees, specifically related to COVID procedure, if that covers since it's a training expense, or not covered because it's not considerable overtime?
The labor hours would have to be overtime to be covered. If you have materials, supplies, equipment that you use to complete that training, that would be eligible because training related to the event is eligible.
For Museum of Natural History, will the masks we purchase for visitors who do not bring their own masks be eligible?
Good question. Again, I'll preface everything. My understanding for the PPE is unless you're using those masks to perform emergency work, treating infected patients is the one that comes to mind most easily, it's not going to be eligible. My argument, and I'm sure all of yours, is we are trying to stop the spread of a virus and protect community health. So why wouldn't that be eligible? That's the argument we're going to make for things they're telling us is not eligible. So that's a TBD for the museum. We'll get back on that for guests.
Address this one.
And that could be for any other location that has public access. So I'm going to compile all these questions and get a response back, and then we'll have that Teams site set up. And so if you want access to that in the general group, we'll post some of these responses. That'll be the best way for us to get centralized information out on the responses. I'm also writing down individual names for the questions as well, or emails. I'd like to know about the computer purchase answer. We have had to move all of our counseling to Zoom meetings. So that speaks to the telehealth, and we will get an answer to that. Can we get a list of covered, not covered with a few details? So there is a document that FEMA has that lists what's eligible and not eligible for Category B expenses. We can add it to the EHS website. It's also part of the presentation that we covered. They have guidelines in place for other types of natural disasters, and now they're having to interpret them for a pandemic. So not everything is going to be spelled out, this is or this is not covered. There's still interpretation that they're doing. Can we push to indicate Garage 11 is a community-based testing site? Yes, I will raise that. Bob asks, would the purchase or rental of a tent that is used to increase social distancing for our band be an allowable expense? Unfortunately, the answer, Bob's, going to be no. They're going to consider that an increased operating cost, even though, again, we're trying to abide by CDC guidelines and prevent the spread of the virus. But there's no emergency work tied to that. We're following guidelines. Another question, my understanding is because COVID testing for individual patients was not available, we can assume all patients we treat are COVID positive. This is for dental. So that, I guess that's why you're saying you had to purchase the PPE, because you didn't know when they walk in the door if they have it or not. So I'll check on that for you. Allison Smith asks, are purchases of masks, gloves, and other supplies for use by personnel responsible to clean and disinfect our facility eligible? My answer is yes. So again, it has to be tied to emergency work, and disinfection of facilities is one of their categories of eligible work. So in order to do that, if you have to have those things to perform the emergency work, those are. The general message, again, will be any PPE expenses. Let's put those when you add up your costs, let's separate those out, because we're going to make one application for the whole university and all the applications we get in, and make that push to get all of them covered. So let's include those as part of that.
It's important to clarify that we need a person or several person in your department in an email so we can add to these team group, because it's a private group, and that's the way you're going to upload your application form and your document. So make sure you email us who is the department and the contact person who will be working with this, so we can send the invite specific to that department and the person.
Okay, well, I know it's a lot of information. It's very detailed and technical, like I led with, so I understand if you haven't jumped into it yet, and you will, you may have questions along the way. If you run across something and you're not sure, just call us or email us. We will help you as those things come up. Got the list of questions that have come up so far. We'll compile answers to those once we get them back from FEMA and the Florida DEM, and get those communicated out to the group here.
Brian, one question.
Yes, sir. Go ahead, Bill.
Obviously, it has to be in by August 7th. We're not playing any sports until at least September, and maybe even later. We don't know anything yet until August. Is there going to be another opening for when we know what our costs are related to events?
Yeah, so the plan here will be in a phased approach. Usually with FEMA, you just have to submit everything all at once for all of your expenses, which makes sense when there's a hurricane. It happens, you clean up, you repair, and it's done. Since this is a long-term thing, they've allowed us to submit based on time periods. So we'll do anything you've incurred through 6/30 will be part of this. And then if you've got stuff this fall, we'll do another phase to cover those expenses for events or students come back, and there's going to be a number of other expenses with that. So yeah, we will follow up again for a phase 2. That's it. Okay. Well, thank you very much for your attention. And again, you've got our information, so we'll get our answers on our end. If you have anything on your end, please feel free to reach out. It's not a fun process, but we want to try to get back as much as we can for the university. So we're looking forward to working with you to make that happen. All right. Thanks, everyone. Have a great day.